Testosterone therapy has been one of the most talked about treatments both in the United States and across the Western world. Testosterone deficiency is becoming commonly recognized among men as one of the leading barriers which prevents a patient from achieving long-term health and vitality, and evidence continues to mount that low-T therapy with patches, creams, and injections are a highly effective means to establish health and virility among male patients with testosterone deficiency. Of course, there is also growing evidence that women can benefit from testosterone. Women have used hormone replacement therapy for decades as a means to mitigate the effects of menopause and the hormone deficiencies that occur as a result of the change. Evidence in recent years accumulates that many of the issues that women experience as they grow older are not simply the result of changes in the feminine hormones, but as a result of declining testosterone production as well. Women produce testosterone throughout their lives, just as men produce low levels of estrogen. Women need around 1/10 as much testosterone as men, but it still serves a variety of important purposes. It stimulates metabolism, improves bone mineral density, and preserves muscle mass. There is also strong evidence that it preserves both sexual and cognitive health as well. Because women don't produce as much testosterone as men, they are more at risk for osteoporosis, and this has been clearly noted in the scientific literature. Testosterone is equally as important for female libido and sex drive as it is for males. In fact, testosterone appears to be the trigger which stimulates sexual desire and libido in both sexes, and testosterone deficiency is one of the leading causes of low libido among both men and women. Furthermore, testosterone is also important for feminine sexual function, priming the female body for sexual activity and increasing sexual pleasure and sensitivity. There are many female celebrities that have openly used testosterone, not for physical performance but for sexual and physiological health. One of the most vocal celebrity proponents for testosterone replacement therapy is Jane Fonda, who has been using feminine low-T treatments for years in her effort to maintain her sexual vitality, and she says it has worked. She explains that she started experiencing issues with desire around age 70, and after taking testosterone treatments specifically designed for women, her sexual health has rebounded in an explosive way. Because she distinctly feels that romance and pleasure are key aspects to a healthy, long, and happy life, testosterone therapy has allowed her sexual desire to meet the demands of her heart. Testosterone treatments continue to be proven safe for men, and there is no evidence at this point showing that small, restorative doses of testosterone cause any issues among women, either. Testosterone therapy with low-T patches, creams, and gels is quickly becoming a medical norm for aging men, but both medical procedure and practice lag behind for women, which may be preventing many women from getting the low-T treatments to improve their health and wellness. For decades now, estrogen hormone therapy with progesterone has been popularly used to help patients, but the potential benefits of hypogonadism therapy for women have not been sufficiently explored by academia and medical researchers. It's becoming clearer as researchers finally turn their minds toward testosterone for women that testosterone provides immense benefits for female patients that have went largely undiscovered through decades of hormone research. There is powerful evidence that diminishing testosterone levels leads directly to many issues long associated with estrogen imbalance, such as diminishing strength, increased risk of osteoporosis, feelings of exhaustion, depression, loss of sex drive, and weight gain. Throughout the 1980s and 1990s, estrogen therapy began to be utilized for women during and after menopause, and grew in popularity until the early 2000s, when an American study performed by the Women's Health Initiative was stopped prematurely as a result of surprisingly high instances of breast cancer among patients using hormone treatments for menopause. This led to a rapid decline in the use of hormone therapy for women. In retrospect, it appears that these fears were the result of false alarms associated with the way that the study was conducted and analyzed, and that hormone therapy is much safer than it was previously considered. As this new information has only begun to disseminate in the last few years, there is still a widely held stigma among both primary care physicians and their patients that hinders women from considering the potentially beneficial option of hormone replacement therapy with a sufficiently open mind. Hormone restoration and optimization is a clear option on the table for women, and there is no reason why they should not have the option to use these treatments to improve their menopausal and postmenopausal experience. Today, menopause is primarily treated through the use of bioidentical progesterone and estrogen in order to minimize the uncomfortable symptoms of menopause. Unfortunately, there are certain things that it appears that estrogen and progesterone HRT can't effectively treat, such as fatigue and lack of sex drive. Testosterone therapy and treatments such as tibolone, which either directly increase testosterone levels or stimulate the release of testosterone, or testosterone-like products in the bloodstream, have been shown to improve these factors. Tibolone, for example, is metabolized by the body into hormones which react in the bloodstream just like progesterone, estrogen, and testosterone, and there is evidence that the treatment enhances sex drive, relieves hot flashes, and increases bone mineral density. An Australian topical testosterone treatment for women called Andropheme was shown to effectively restore testosterone levels to normal for women. There was some worry from endocrinologists and cancer specialists that testosterone therapy could heighten the incidence of breast cancer, but a large-scale survey of medical data conducted in 2010 provides strong evidence that this is not the case, and that restoring testosterone levels to normal could protect the body by reducing the risk of breast cancer. There is good research out there that clearly shows that testosterone treatments can help women bolster sexual desire and sexual thoughts, and that low T directly leads to issues with sexual health among women. Testosterone therapy for women can help patients of all ages struggling with testosterone deficiency restore their sex drive and their optimal sexual function. Furthermore, testosterone replacement has also proven to be beneficial for women suffering from mood issues. In one particular study, women that were prescribed antidepressant medications were found to experience improved psychological well-being derived directly from their use of testosterone therapy. The patients in this study were all between the ages of 35 and 55. In addition to sexual and emotional health, testosterone also appears to preserve cognitive function in women. Among women with testosterone deficiency that had already experienced menopause, testosterone therapy treatments led to major beneficial enhancements to memory, verbal memory, and general mental function. With all of the men across the nation which get to experience the fantastic benefits of testosterone, women have largely been left out in the cold with regard to this highly potent hormone therapy treatment option. There aren't enough hormone doctors and clinics that offer the service to women, and general practitioners are commonly behind in their knowledge with regard to the benefits of testosterone therapy for women. Testosterone levels can be easily tested with a simple blood test and can help women dealing with frustrating changes in their sexual performance find out if testosterone can help them recover their desire and their romantic urges. One big reason why women are underserved with regard to testosterone is that there are very few products available explicitly for women with testosterone deficiency. Whereas men have a litany of options ranging from low-T injections to patches to sublingual gels, women are largely confined to specialized products made at compounding pharmacies. In the near future, there is no doubt that the medical community will experience a heightened awareness of feminine low-T, and more products will become available for women that can benefit. For now, don't be afraid to breach the idea of low-T therapy with your doctor. If you found this video informative, please press the like button and subscribe to the channel. To learn more about health and wellness regarding testosterone replacement therapy, please click the link below in the description.